Welcome back to Metabolic Mind, where we explore the connection between metabolic and mental health and metabolic therapies like nutritional ketosis as therapies for psychiatric conditions. I'm Dr. Brett Scher. Now, in our prior video, we discussed the lab workup most experts recommend before starting nutritional ketosis for mental illness, including how often someone should consider checking those labs and what you may expect to see as ongoing changes. Today, we're going to take it one step further and explore the lifestyle metrics many experts recommend tracking when treating psychiatric conditions. Now, the beauty of these metrics is that they can be incredibly helpful and they don't require a physician's order or a trip to the lab or anything. I'll cover 4 metrics in this video. One is ketones, another is sleep, a third is activity levels, and the fourth is timing of food intake. And while these may sound simple, they're really impactful, and how you measure and act upon them can significantly affect your mental health. So sometimes the simple things can really make the biggest impact. But before we get started, please remember, our channel is for informational purposes only. We're not providing individual or group medical or healthcare advice or establishing a provider-patient relationship. Many of the interventions we discuss can have dramatic or potentially dangerous effects if done without proper supervision. Consult your healthcare provider before changing your lifestyle or medications. All right, so now let's get into the metrics to follow. And the first I wanted to cover is ketones. One of the unique aspects of nutritional ketosis is that you can clearly tell if you're succeeding with your dietary goals simply by measuring your blood level of ketones. You'll be in ketosis if your blood ketones measure at or above 0.5 millimoles per liter. Of course, this is somewhat arbitrary and people may see benefits at lower levels, but it's generally accepted that above 0.5 millimoles per liter is sufficient for nutritional ketosis. But now remember, the goal of therapeutic ketosis is twofold. The first goal is just to lower carbohydrates and improve insulin resistance to lower insulin levels and improve metabolic health. But the second goal is to produce ketones which provide a more efficient fuel source for the brain. Ketones have a direct brain effect, potentially reducing neuroinflammation, balancing neurotransmitter levels, improving mitochondrial function, and more. Therefore, changing your food and improving your metabolic health is likely beneficial, sure, but you may also want to be very clear that you're producing adequate ketone levels. Now, notice how I said that though. Adequate levels of ketones. So what are adequate levels? Well, as I mentioned, blood levels above 0.5 millimoles per liter is considered nutritional ketosis. However, some people report having better symptom relief at higher levels. We don't yet have quality published research to suggest this is uniformly the case, but that research is ongoing. Some physicians who use nutritional ketosis for mental illness or other neurologic conditions like dementia or others agree that higher ketone levels between 1.5 and 3 can sometimes provide better symptom relief than lower levels. But this varies by individual and is one of the many reasons we recommend working with an experienced clinician, either a doctor, or a dietitian, or a health coach who can help guide you more specifically based on your individual circumstance. Now, some people can increase their ketone levels by either increasing their fat intake or decreasing their carb intake, by adding MCT oil or even taking exogenous ketones, or in some cases reducing protein. But a little caution about that. It's still essential to ensure that you remain within the adequate protein range of around 1 to 1.2 grams per kilogram of reference body weight. And so you can see how things can get tricky, right? Which is why working with an experienced clinician is pretty essential. And then lastly, exercise and intermittent fasting can also help people increase ketone levels. Now, there are numerous devices that exist to check your ketone levels. The most common is a finger stick test, which is likely the most accurate. We don't really recommend using urine strips as they can be the least accurate, and breath monitors are becoming more prevalent as the technology and accuracy improve. The key is picking a method that you can stick with and measure it consistently. Now, there are many different options on the market, but according to a test published at dietdoctor.com, Keto Mojo seemed to be the best choice, with Precision Extra being a good alternative, and there are also newer meters on the market like Keto Coach and others. So you got to pick one that works for you and stick with it. Now, not all experts agree on when to test ketone levels, but one approach is to start testing it multiple times per day. You can test when you wake, midday, a couple hours before dinner, and in the evening. And I know that sounds like a lot. But you may only need to do that for a few days to understand your pattern. Then once you understand your pattern, you can continue testing at the time when your ketones are lowest. But that's just one approach. The other approach is keep things simple and just check every morning. It really all depends on how testing fits into your lifestyle and your progress. If you're doing great, everything's moving well, everything's responding well, you may not need to test as often. But if you're struggling either with your psychiatric symptoms or your food consistency, that's when you may want to start testing more frequently. So adjust according to how you're doing. All right, now let's move on to the second function to consider tracking, your sleep. Sleep is critical when it comes to psychiatric conditions. Now, most of us can easily tell if we slept really well or really poorly, but there's a significant middle ground where we may not detect small changes, but small changes that may be significant changes. For those with serious disorders like bipolar, sharing sleep metrics with a caregiver can help prevent relapses into mania or depression. For example, a difference of just 30 minutes a night can impact your mental health, especially if it continues for days in a row, or if 30 minutes becomes 45 minutes and then eventually 60 minutes. So the cumulative lack of sleep may eventually lead to mania, psychosis, or even worsening depression for certain susceptible people. Increasing sleep can also indicate a slide into a depressive episode. So it's crucial to track sleep objectively. You can track sleep with multiple different devices, from rings and wristwatches to phone apps and mattress sensors, all with different price points and effort. The key is finding something that works for you and sticking with it regularly to monitor for changes. In our interviews with Matt Bazuki, an individual with lived experience with bipolar disorder, he frequently remarks how important it's been for him to track his sleep. Now, I know he uses the Oura Ring and really likes it, but we've heard from others who are happy using Fitbit and Whoop or watches and other devices. So again, the key is to find something that works for you and your lifestyle. Now, one question can be, all right, I'm tracking it, but how do I improve it, right? How do you improve your sleep? You've likely heard many recommended tips. There are lots of websites and blogs and videos about this, but here are a few of my favorites. And the first is stay consistent with your schedule. Try to go to bed and wake up the same time every day. I know some find this challenging with the fluctuations in daily schedules, but it's crucial to prioritize this so your body kind of knows when it's time to sleep and to wake. Even if you can't get to sleep at the same time, try to wake up at the same time each day and get morning light as soon as you're awake. Many individuals report that even as little as 5 minutes of outdoor morning sunlight before 10 a.m. can significantly impact sleep and mood. Second tip is make sure your sleep environment is conducive to deep sleep, which means dark, cool, and quiet. Blackout shades, face masks, mattress coolers, and earplugs are some of the tools that can help. Third is, and this is another big one, it's avoiding or minimizing sleeping pills or alcohol, as these may disrupt sleep quality. So many experts recommend focusing not just on the amount of sleep, but also sleep quality, meaning how much deep sleep and REM sleep we get each night. Medications, drugs, alcohol, they can interfere with sleep quality. So just because you're sleeping a little more doesn't necessarily mean you're sleeping better. And one other interesting finding is that many people find that not eating for 3 hours before bed can also improve sleep quality. So something to consider. And you also get the benefit of maybe metabolic health improvements there. Now, there are many other tips, but the last one I want to focus on is adjusting your lights to prepare for sleep. It's all too easy to be in brightly lit rooms, watching brightly lit screens until the minute before we go to sleep. It's much better for sleep duration and quality to gradually dim the lights and avoid bright screens in the hours leading up to bedtime. Some people also use blue light blocking glasses to help. And one study actually demonstrated using blue light blocking glasses for a few hours before bed may help prevent manic episodes, which can be especially helpful as the days get longer in spring and summer. Okay, so that was sleep, the second metric. Now the third metric, which is your activity level. Physical activity is a crucial aspect of metabolic therapy, but it's kind of easy to mislead yourself about how active you are. I mean, it's easy to say, yeah, I did a good job today. Well, was it a good job 5,000 steps, 12,000 steps, or did you get your heart rate up with high intensity interval training? I mean, that's hard to know without tracking it. So pick an activity tracker you like, or even use a smartphone app or an old-fashioned pedometer and stick with it to objectively track your physical activity. Now, what's your goal? Well, that's really hard to say as it varies from person to person, but many clinicians recommend measuring your baseline and setting a goal to increase that by about 10 to 20% each month. Now, if you do want to increase your activity level, what's the best way to do it? It sounds simple, but the best advice is finding something you enjoy doing. Do you enjoy walking or dancing, lifting weights, riding a bike? What's your favorite way to move your body? It's really easy to say go on a treadmill and walk for 30 minutes a day, but for some people, that's the most boring thing in the world and it's total torture, whereas others really like it. So if it is boring for you, it's pretty unhelpful advice. So don't feel like there's only one way to get physical activity. There are literally hundreds. All right, now the final metric I want to talk about is the timing of eating. If you're in nutritional ketosis, you're undoubtedly tracking or at least paying attention to how much carbs you're eating. But in addition to what you eat, when you eat is also important. Research tells us that giving your body time when it isn't consuming or digesting food likely helps metabolic processes. Time-restricted eating can help improve metabolic health, but what's the right level? Is it 18 hours of fasting and 6 hours of eating? Or is it 14-8 or 12-12? I mean, to be honest, the truth is we don't know what the sweet spot is for optimal benefit. It may vary between people and also depend on what someone's eating and how active they are and their other lifestyle factors. That doesn't mean we all need to do 5-day fasts, as some health experts suggest, but quite the opposite, actually. I strongly discourage anyone with a psychiatric condition from doing an extended fast unless recommended and closely monitored by an experienced physician. Instead, it means that we should all be purposeful about when we eat and be mindful of why and how often we snack and make a conscious effort to space out our meals, if possible, to allow for metabolic benefit. Now, of course, you can follow many other health-related metrics, so many, in fact, that it can become like a full-time job. The key is measuring the things that provide the most benefit while still being convenient and easy to fit into your day. And that's why we recommend tracking the 4 we discussed today: ketones, sleep, physical activity, and the timing of your meals. By combining these metrics with the labs we suggested in our prior video, you'll be well on your way to having the vital information your clinical team will want to help you on your path to metabolic and mental health. So thank you for joining us today at Metabolic Mind. If you found this video helpful, please click the thumbs up and subscribe button, and please leave a comment, as we would love to hear from you and hear what metrics you find most helpful to follow and how often you track them and the best ways to track. We'd love to hear from you as well. Have a great day, and we'll see you next time here at Metabolic Mind.